Weeks now, experts have told the public that wearing most protective masks won't stop you from getting the coronavirus. But there are reports that the CDC may shift their stance now and say masks can help stop the spread. Now, last night, Tucker Carlson claimed we were lied to when they said that only healthcare workers should wear them. Watch the clip, see what you think.
Masks don't work unless you work in a hospital? How does that work? Does mask effectiveness change based on what job you do? They're only useful if you're already sick? What? Coronavirus can spread from asymptomatic carriers. That doesn't make any sense whatsoever. We understand there's a shortage of masks. We understand only certain people should get them because it's a triage moment. We get it. But stop lying to us because it makes us cynical. It divides the country. Tell the truth. We can handle it.
So were they lying to us, or are they all still trying to figure it out just like everybody else? What do you think? I mean, are you going to start wearing masks out when you're outside, Sarah?
Well, I think it's hard to gauge whether it was lying because lying locks into intention. And I'd like to believe that people don't intentionally mislead, especially in a health crisis like this, although we have seen a lot of misinformation. Max and I just had this conversation yesterday. When we do have to leave the house to go to the grocery store, everyone, about 8 out of 10 people, are wearing masks. And what keeps running through my head is, we don't even know where to get a mask because our understanding was there is a massive shortage. And I don't want to be taking a mask from someone who is on the front lines and much more at risk. But am I being irresponsible by not finding a mask? And can you wear those masks more than once? There's so many questions right now as to what we should be doing to be as responsible as we can.
Right. The other question people are asking is, do they think that this hurts the CDC's credibility? I throw that to you, Megan.
You know, I think that it's always best to treat the American public like we're adults and not toddlers. Most conservatives I know are very skeptical of the government in general and government overreach. I actually had found in a suitcase in my closet from a trip to Asia a while ago, I actually had a bunch of masks left over that we wore there because of pollution. And I actually ended up donating them because I thought, you know, much like you, Sarah, the frontline health workers and people who are doing risky jobs are the ones that should be wearing these. And when I read yesterday that the CDC is now considering advising Americans to now wear them, I'm just confused because I've had multiple healthcare officials and people in the medical industry tell me they don't do anything. They don't do anything for you. It only does something for you if you're sick. And to my knowledge so far, I am not sick. So I think there's just a level of confusion. And now on Twitter and in different places, there are now conversations about this malaria drug and whether or not this malaria drug could actually be the vaccine. And part of the problem is I keep reading articles about people who have been very helped by taking this malaria medication. I'm not a doctor. I'm not anyone who knows anything other than what the rest of you know. But if the government is lying to us, this is going to breed panic in a more significant way. And I really agree with Tucker Carlson that just treat us like adults. I am the first person to say, I'll give masks away. I'm not a nurse. I'm not a doctor. But now when you're saying we should now be wearing them, how exactly am I going to get a mask? There is a shortage.
Right. Go ahead, Sonny.
You know, it seems to me that because the government has given us so many mixed messages, and we've heard so many mixed messages from the president especially, that people are not trusting what they're hearing from the government, and that's led to this mistrust. But I was speaking to Manny this morning about this very issue. Do you wear the mask? Do you not wear the mask? And his take really was, because there is a shortage of testing, because we don't know who is symptomatic and who is asymptomatic, wearing the mask for everyone is very helpful because it will stop the spread. And we know that it is very important to stop that spread. So if you're a carrier and you're asymptomatic and you have that mask on, you will not give it to someone else. And it also prevents you from touching your face, touching your mouth, touching your nose. And so if you touch a surface where the coronavirus is still living, it prevents you then from getting it. So those are the two reasons why you would have the mask on. So you don't need the N95 mask that protects healthcare workers, right? You can use anything. You can use sort of like a bandana. You can use one of these disposable masks that don't necessarily add to the shortage of masks that, healthcare workers really, really need that are on the front line. So I just wanted to say that because that's the information that I got from my husband this morning, and I am wearing a mask when I'm outside because if I'm asymptomatic, I want to make sure that I'm not spreading it to anyone else, and I want to prevent myself from getting it as well.